My name is Stacey Shilts. I'm the audiologist here at Logansport Memorial Hospital. I've been here for 15 years almost, and I've been practicing for 25 almost. So I love my job and I love helping people hear better. An audiologist is a professional who diagnoses and treats hearing loss. And basically, anyone who notices that they're having a difficult time hearing or understanding others, or if other people are telling you that you're having a difficult time hearing or understanding, or even if somebody's saying the TV is way too loud, it's probably time to get a consult. It's important not to delay seeing an audiologist because whatever may be happening is treatable. So whether it's just hearing loss that can be treated with hearing aids, or maybe it's just a medical issue, possibly just a wax impaction or something that can be treated easily, or even other issues that may be going on that can be treated by a medical provider. There are typically 3 types of hearing loss, one being a nerve type hearing loss where the nerve, the hair cells inside the nerve are just basically dying off. That is a permanent hearing loss. The second type of hearing loss is called a conductive loss. That's basically when we have a medical issue like wax impaction, ear infection, those sorts of things. The third type is just kind of a combination of both. We call it a mixed hearing loss. Both ears do not always suffer the same amount of hearing loss. Typically, the ears do function at about the same level. So when there is a difference, usually that indicates something is going on. We always like to look into that a little bit further. So if you have a nerve type hearing loss, or even one that's kind of a combination of a nerve type and a conductive type, it can be permanent. So when those tiny little hair cells inside your nerve, your hearing nerve, die off, they cannot regenerate. So it is a permanent hearing loss. Treatment options for hearing loss. You've got hearing aids for nerve type hearing losses. You've got, if it's some type of a medical issue that's causing the hearing loss, medical intervention can be done to treat that type of hearing loss or even the mixed type of hearing loss. And then also cochlear implants. I want to kind of touch on over-the-counter hearing aids because it's a very new issue that just started a couple of weeks ago. So over-the-counter hearing aids are actually now available at different department stores, pharmacies, that sort of thing. I just want people to be aware because there are so many people out there that don't have coverage for hearing aids and don't have a lot of money to spend. In that sense, it's really nice for those people, but at the same time, you have to be careful because you really, really, really need to have an evaluation done by an audiologist prior to getting a hearing aid. And the reason is these over-the-counter hearing aids don't require a prescription, but my concern is there are going to be a lot of people who think, oh, I have hearing loss, I need a hearing aid. They go and spend the money, and maybe all they had was a wax impaction. Or maybe they have fluid in the ear, or maybe they have something more serious going on that could be treated that is just missed. So it's very, very important that you still get a full evaluation done by an audiologist just to really make a more educated decision and also to make sure that the hearing loss is appropriate for an over-the-counter hearing aid because those are more appropriate for mild to moderate hearing losses. And a lot of people, even if they have a mild hearing loss, a lot of people are so devastated by it, they think, I can't hear, I'm deaf. but it's a mild hearing loss where, you know, maybe that would be okay for them. But it's always important to really get evaluated and really be more educated before you take that step. So, like I said, over-the-counter hearing aids are good for mild to moderate hearing losses. If someone comes in with a very mild hearing loss, but they feel like they're really, really struggling, if they purchase a hearing aid over the counter that may not be totally appropriate for them, it's possible that they could be getting too much power and wearing it too loud, that it could cause further hearing loss, permanent hearing loss. So we want to be careful with that as well. A cochlear implant is an implantable device that is actually surgically implanted underneath the skin and implanted into the cochlea, which is the hearing organ. There is a processor that you would wear externally, and that just helps a lot of people who have a significant amount of hearing loss or a significant problem understanding. Okay, so a cochlear implant works a little bit differently than a hearing aid. A cochlear implant actually creates electrical impulses to send the messages to the brain. So whereas the hearing aids, they send acoustic information. So that's kind of the difference there. And basically, an implant can last many, many years. It can be upgraded. The external processor can also be upgraded. So as far as, you know, the life of a cochlear implant, I mean, it can be several years. So. Someone, as I said earlier, usually people who have a significant amount of hearing loss or a significant problem understanding, or a combination of both. So we do the hearing evaluation to kind of determine the extent of hearing loss and understanding ability, and then we would then refer on for a cochlear implant evaluation, which is a little bit more in depth of what actually are you able to understand in terms of sounds, words, sentences, those sorts of things. So a typical kind of journey for a patient, they come in for a hearing test. If a cochlear implant evaluation is recommended, they would come in for the evaluation. And then if we find that the patient is a candidate for cochlear implants, then a referral would be sent to Drs. Yates or Nelson down in Indianapolis. The patient would go for a consult. If they agree everything looks great to go ahead with surgery, they would also have the surgery in Indianapolis. So 2 visits to Indianapolis, one for the consult, one for the surgery. Once that's done, basically the patient can come here for all of the activation, the follow-ups, anything. So that way it kind of saves them a trip, and several trips actually, to Indianapolis. So if they live in the area, it's just a lot more convenient for a lot of people.